Everyone has differing views when asked when we should open the state. We've heard from protesters, lawmakers, and people just like you. But now we're hearing from the healthcare professionals. Jamie Perez shares one UW Health doctor's message.
Communities all over the country have been filled with applause for healthcare workers over the past month. But some of that applause now turning into protests from people who want to reopen the state.
We know that if we were to reverse social distancing without a lot of thought and a lot of attention to detail, that we would most likely see a second wave of COVID-19 and our curve would start to peak again.
Dr. Jeff Pothoff at UW Health said he understands why people want to reopen the state. But Pothoff said the virus should be the determining factor of what the timeline for that looks like.
I think, what we really want people to understand is that these types of decisions need to be made with science and data and not emotion.
When asked if now is a good time to try to reopen,
the science behind infectious diseases and pandemics would definitely say no. This would be exactly the wrong time to very quickly reverse social distancing.
Pothoff said opening the state too soon could be fatal and could reverse the work that the healthcare system has done to save as many lives as possible.
If those guidelines are not followed, we are certain that there will be people at these gatherings who have COVID-19, who don't have symptoms, and they could likely spread it to other people at this gathering.
Pothoff urges those who are considering protesting to also consider this.
Think about the families, the 200 families in the state who have lost a loved one, who are struggling now, who are grieving their loss.
In Madison, Jamie Perez, News 3 Now.
And what could be the cost?
Pothoff also said that he's glad that people are exercising their right to protest and believes everyone should have their voices heard. He says if you are planning to protest, please wear protective gear and face masks and continue to practice the 6-foot rule to limit the spread as much as possible.